Welcome back to the Best PT Podcast. This is the first episode in the cardiopulmonary system, episode 4.1, Cardiovascular Anatomy and Physiology. Let's start with the heart. We have two confusing names for places in the heart. The apex is actually the lowest part of the heart, and the base is the upper border of the heart. We have the endocardium, which lines the interior of the heart chambers and the valves. We have the epicardium, which contains the epicardial coronary arteries and veins, autonomic nerves, and lymphatic nodes. We have the myocardium, which is the contracting layer of cardiac muscle cells. And we have the pericardium, the double-walled sac of connective tissue that surrounds the heart. We have the great vessels of the heart. The aorta is the largest artery in the body. The superior vena cava is the large vein that returns blood to the right atrium from the head, neck, and arms. The inferior vena cava is a large vein that returns blood from the lower extremities and organs into the right atrium. We have two paradoxically named pulmonary arteries and veins. Pulmonary arteries carry deoxygenated blood to the lungs from the heart, and pulmonary veins bring oxygenated blood back to the heart from the lungs. Systemic blood flow. Deoxygenated blood first arrives in the right atrium. It then pumps through the tricuspid valve to the right ventricle, through the pulmonary semilunar valve to the pulmonary trunk, and then to the pulmonary artery to go to the lungs. From the lungs, oxygenated blood returns to the heart to the left atrium. Blood then pumps through the bicuspid or mitral valve to the left ventricle, through the aortic semilunar valve, into the aortic arch, and then branches to the thoracic aorta or descending aorta, or superiorly to the brachiocephalic, common carotid, and subclavian arteries. Coronary blood flow. Remember that the heart also has to supply itself with oxygenated blood. These coronary arteries stem off the aorta and wrap back around the heart to supply the myocardial tissue with blood. Impairments or damage here in the coronary vessels can lead to myocardial infarction or heart attack. In the outline, I have a really nice hand-drawn picture of coronary blood flow, but to keep it simple, we have two major coronary arteries, the right coronary and left coronary arteries. The right coronary artery further branches into the sinus node artery, which supplies the right atrium, the right marginal artery, which supplies the right ventricle, and the posterior descending artery, which supplies the inferior walls of the left and right ventricles, as well as part of the intraventricular septum, the lining that separates the ventricles. For the left coronary artery, it splits into the circumflex artery that supplies the left atrium, as well as the walls of the left ventricle, when we have the left anterior descending artery that supplies the anterior aspect of the intraventricular septum. The cardiac conduction system. The sinoatrial node, or SA node, is the normal pacemaker of the heart and is located in the superior right atrium. The SA node fires electrical impulses towards the atrioventricular, or AV node, that's in the inferior right atrium, which further carries the signal to the common AV bundle, or bundle of His, in the superior intraventricular septum, to the right and left bundle branches that are further distal in the intraventricular septum, and finally to the Purkinje fibers that are in the inferior intraventricular septum. Heart neurology. Innervation of the heart. Remember that heart cells are autorhythmic in nature, meaning they depolarize and contract on their own without outside innervation. However, they can be modified by the vagus and sympathetic cardiac nerves. The vagus nerve supplies parasympathetic innervation, and the sympathetic cardiac nerves form the cardiac plexus in the heart base for sympathetic innervation. Sympathetic nerves cause the release of epinephrine and norepinephrine to stimulate the heart to beat faster and with greater contractile force. Parasympathetic influence causes acetylcholine release, which slows the heart rate via the SA node. Some neural reflexes. The baroreceptor reflex helps maintain regular blood pressure through arterial baroreceptors that are high pressure receptors and cardiopulmonary receptors that are low pressure receptors. The Bainbridge reflex increases venous return by stretching the walls of the right atrium, which signals the cardiovascular control center within the medulla via the vagus nerve to suppress parasympathetic activity, which leads to an increase in heart rate and increases blood outflow. The chemoreceptor reflex detects changes in blood pH and blood oxygen levels, then stimulates respiratory centers to increase the rate and magnitude of ventilation. And finally, the Valsalva maneuver, defined as forced expiration against a closed glottis. This results in increased intrathoracic pressure and central venous pressure that decreases venous return, which causes a subsequent increase in heart rate and cardiac contractility. Talking about the cardiac cycle, we have atrial systole, which is the contraction of the atria pushing blood into the ventricles. We have atrial diastole, the period between atrial contractions. We have ventricular systole, the contraction of the ventricles pushing blood out to the lungs and the aorta. And we have ventricular diastole, the period between ventricular contractions. Preload is defined as the tension in the ventricular walls at the end of diastole. And afterload is any force that impedes blood flow out of the heart, such as the pressure within peripheral vessels. Stroke volume is the volume of blood ejected by the left ventricle per each contraction. Normal stroke volume is 60 to 80 milliliters. And then cardiac output is calculated by multiplying heart rate by stroke volume. This is the amount of blood pumped per ventricle per minute and is normally 4.5 to 5 liters per minute. This can increase to 25 liters per minute during exercise. And for a frame of reference, a high pressure kitchen faucet left on will only produce 5.6 liters per minute. Finally, talking about blood. Normal blood volume is 4.5 to 5 liters. Plasma is the liquid component of blood. Red blood cells, or erythrocytes, contain 40% of blood volume. Platelets, or thrombocytes, assist in blood clotting by clotting together to form what's called a platelet plug. And then white blood cells help us fight infection. We have 5 major types of white blood cells. Neutrophils ingest bacteria and cellular debris. Lymphocytes, we have 3 types of lymphocytes. T lymphocytes and natural killer cells protect against viruses and fight cancerous cells. B lymphocytes produce antibodies. Monocytes destroy dead or damaged cells and defend against infectious organisms. Eosinophils kill parasites, destroy cancerous cells, and are responsible for allergic responses. And then basophils are also responsible for allergic responses. That's it for episode 4.1, talking about cardiovascular anatomy and physiology. Episode 4.2 will talk about pulmonary anatomy and physiology. Thank you for joining me.